Hi everyone, this is Xiaomeng. Thank you for having me. I'm glad to present this work today on behalf of my fellow team. This work addresses the question of how do we collect and use social demographic data to support community-based health interventions. We identified 6 social demographic data collection tools and shared 2 examples on assessing the well-being and health needs of community. I'll also go over a case study on the Greater Hamilton Health Network, OHT. The Greater Hamilton Health Network shared their important experience with us on collecting social data from healthcare seekers and people living in residential care facilities. So social demographic data is important for targeting health interventions, but it is not adequately recorded in our system. The benefit of collecting social demographic data is multifaceted for patients, health organizations, providers, and payers, including strengthening the patient care team member relationship, planning and tailoring services, and empowering health organizations to advocate for new policies. In addition to social data, community health need and well-being data should not be overlooked because it furthers our understanding on the community we serve. This portion of data can help to assess the current practice against the healthcare models and collect evidence demonstrate the impact of our community work. These 2 domains of data better prepared healthcare workers to take actions that helps community residents, especially those are marginalized, to realize evidence-based decision-making in collaboration with the community. So for social demographic data collection tools, we found 4 Canadian questionnaires and US-based questionnaires from our research. These social data collection tools were determined based on first, the feasibility of gathering information from responders, and second, whether these tools' design was intended to support health intervention work. These collection tools that were shared today have been empirically validated in the real-world scenarios. For the US-based questionnaires, the prepared questionnaire is an important one. It contains 21 social determinants of health domains that have been paired with an implementation and the action toolkit. These 2 try to address the social data standardization issue faced by organizations. The collected data can be standardized across ICD, the disease diagnostic codes, and other controlled medical vocabularies, which means that this social demographic data can be entered into the existing EHR systems without any adaptation. For Canadian-based questionnaires, 3 Canadian-based questionnaires shared a similar design, which I'm referring to the Social Demographic Data Collection Survey, the Measuring Health Equity Demographic Data Collection Survey, and the Toronto Public Health Equity Data Collection Survey. They include the questions that link to issues significantly impact the patient and the client health outcomes. The questions always ask for information on language, birthplace, race or ethnicity, gender or sex, sexual orientation, disability, income, and income support. The upstream lab particularly ask for information of housing status, which also makes great sense because housing is taken as an important consideration among all social determinants of health. The last Canadian-based questionnaire was designed by the Greater Hamilton Health Network in collaboration with experts from the McMaster. Compared to the 3 previous questionnaires, it has emphasized more on collecting data on indigenous identity of individual, whether the individual has a health card, having a family physician, and what is the employment status and health type of the individual. For more details on accessing the specific questionnaires, the use case of each questionnaires and the particular survey items, you can refer to our full report and which will be online soon. Assessing community well-being and the need for healthcare involves evaluating the overall health and the quality of life of a specific community or a population. And as the process helps to identify health-related challenges and determines the necessary health services and the interventions required to address. Based on the evaluation examples from the Access Aliens and the University of Waterloo on their regional community, questions are to ask for assessing a community need and well-being always include first is their self-rated physical and self-rated mental health, the length of time they spend living in that community, the number of relatives and close friends, sense of belonging, sense of trust, and their feeling about inclusion and discrimination. For conducting such an assessment, we encourage OHT to start from first forming a steering committee and then define the community you will assess, identify assessment objectives, identify principles concerning diversity, develop a comprehensive work plan, and engage the community in reviewing your findings. Finally, last but not least, when we last year interviewed the Greater Hamilton Health Network for their experience of interacting with deprived communities and gather data from them to design customized healthcare services. First, it was shocked for us to find that the high deprivation rate and the big difference in life expectancy and the poor healthcare access of those who live in the residential care facilities in the Greater Hamilton area. To improve the situation, the Greater Hamilton Health Network, OHC, has introduced a race-based and social data collection into various projects they developed, like a lower limb program and the Women Health Days. From their experience of tailoring services to serve the community, we found the most important step first is always to building trust with your client. And then following that is listening to their needs, addressing their instant healthcare issues, providing them with social support, and then try to link them to primary care physicians to establish a long-term healthcare pathway. It was also more easier to start from grassroots rather than start from big organizations based on their experience. Data integration is a big challenge they faced. Having partners coming together with a shared objective, a unified platform, and the common set of questions was crucial to standardize the information and also to prevent its misuse against the vulnerable population. Other than this, aligning goals with partners and building trust among stakeholders are critical topics we identify from this case study. And also, these are long-term goals to achieve the sustainability of an intervention program. Thank you so much for your attention. Hope you'll find it something useful for your work. Thank you so much.